Okay, I'm doing an IV administration of a primary IV tubing. I've got a patient, Ellen Davis, date of birth is 9/19/1963, with no known allergies. Diagnosis are CHF and pneumonia. My order reads to administer 500 milliliters of sodium chloride at 125 milliliters per hour times 1. So what I'm going to do is I'm going to gather all my supplies, carry it to the patient's room, knock on the door, enter, introduce myself. Good morning, Miss Davis. My name is Leslie RN. I'm going to be administering your IV solution today. I'm going to verify the band, make sure that it's Ellen Davis and her date of birth says 9/19/1963 with no known allergies. I'm going to also ask her to verbalize her name, date of birth, and that she has no allergies. I'm going to go ahead while I'm doing that and check the IV site, make sure there's no redness, inflammation, signs of infection, no edema to the area showing infiltration. And then I'm going to go ahead and verify the order with her and let her know that Dr. Jones has prescribed a administration of an isotonic solution, which is the 0.9% sodium chloride, due to her having some fluid imbalance. So we want to replenish fluids. Also want to go ahead and advise her before we're going to do an assessment, check her lung fields to make sure there's no crackles, wheezing, check her for edema, check for any signs and symptoms of fluid overload, and advise her of those to report. If she does experience wheezing, increased dyspnea, any infiltration or coolness to the IV site, swelling, painfulness, tenderness, any redness, ask her if she agrees with the administration. She says yes, okay. So I'm going to perform hand sanitization. Go ahead and open up my IV bag. Hang this here. Go ahead and perform hand sanitization. And don some gloves. I feel like this is better to prevent infection between me and the patient. Utilize an aseptic technique. Open up my IV tubing. Make sure you get it to where there's no kinks. I'm going to take my IV bag down. Remove the tip here, cap. Insert to the IV bag. Make sure the roller is clamped so you don't lose your IV fluid, which it is. Okay. I'm going to fill the port here about halfway full. I'm going to open the tubing to prime slowly. Once the IV tubing is primed, you can do this with the cap on or cap off. Take the cap off, you need to hold on to it. You're going to assess your sites, your tubing to make sure there are no bubbles. If there are, you're going to advance them upward, back up into. I'm going to reclamp. Alright, and then I'm just going to verify the site again. I've already flushed it to make sure that it's patent. I don't see any signs of infiltration, phlebitis, anything that would cause a problem. Then I'm going to alcohol swab the port site tip for 10 seconds vigorously. Remove the cap. I'm going to attach here. To figure out our drip rate, we're going to take 125 milliliters, multiply it times 10, the drops factor that was given to us, and divide it by 60. I'm sorry, which you'll get 1,250. Then you divide that by 60 minutes. You're going to get a rate of 20.83 rounded up. It's going to be 21 drops per minute. And the whole 500 milliliters is to infuse over 4 hours. Okay. The way you're going to do that is you're going to make sure to advance this slowly until you get to 21 drops a minute in this port. Okay, you do that by utilizing your watch. And you want to definitely let your patient know while you're talking to her and giving her the symptoms to report, the dyspnea. You're going to do frequent monitoring of her vitals, which would include her lung auscultation to see if there's any crackles, wheezing present. Check her extremities for edema to make sure that there's no fluid buildup. And just watch the site, have conversation with her to make sure that it's not infiltrated into the tissue. Okay? If she feels any coolness, make sure she reports that as well. When you're finished with that, you want to make sure that you label your tubing and your IV bag. So you're going to put the solution, which is the 0.9% sodium chloride, patient's name, which is Ellen Davis, the date, which is today, my initials, the prescribed rate, which is 125 milligrams per hour. The time I started it is at 12:55. It's going to run for 4 hours, and you can put the time end on there, okay? And you'll take it to your IV bag. Then also you want to make sure that you label your tubing with the date, the time, and your initials, along with the drop factor, which I usually put on there, which is going to be 21 drops per minute. Then you clean up all your supplies, perform hand sanitization, and see if the patient is comfortable or if she has any questions or concerns that needs to be answered.